much, and what I will do now for the next 20 minutes is to give a little bit of nut in a shell of some of the presentations on imaging and valvular heart disease, and give you a little bit of a flavor. There were a lot of presentations. Imaging, as you know, is one of the areas that had quite a lot of developments, technological developments, as well as clinical applications. So it's quite an exciting area. And valvular heart disease, as you also well know, it's been quite an exciting area also over the last few years. So let's start by talking about some of the presentations regarding imaging in the setting of coronary artery disease and ischemic heart disease. And one of the studies that was presented was quite interesting. It's the platform study. It went to look at the clinical outcomes of FFR-guided diagnostic strategies versus the usual care in patients with suspected coronary disease. But the thing here was the use of non-invasive FFR. As you know, FFR, particularly after the FAME study, is now quite fashionable and quite relevant from a clinical standpoint in any cath lab around the world. But here, the interesting point was actually, as you know, there's been the development of the heart flow and a new system which can allow to use non-invasive FFR. It's still in the research arena, but it's quite exciting, and it may actually open the way for doing non-invasive hemodynamic assessment of the significance of the coronary lesion. So this study was a study in stable patients with stable symptoms with coronary artery disease, and they were divided in two main groups. One group was a group of patients who had planned the non-invasive test to assess their coronary disease, and the other group of patients were patients who already had a planned invasive coronary angiography. And each one of the groups was divided in two subgroups. One of the group will go through the standard procedure. In the standard non-invasive test, they did a functional test, either a stress echo or stress MRI or any sort of functional test. And the other half, they did a CT angio with FFR, and they were guided by this study. And on the planned invasive coronary angiography group of patients, they were also divided in two groups. So one group went straight to the invasive coronary angiography, and the other group went through the CTA and FFR assessment. So the clinical results were available to the care team within the next 24 to 48 hours, and then they went to look if there were significant coronary disease and also at the usual MACE of death, MI, and so on. And what is interesting is showed here on this slide. On the left side, you can see that on the group of patients who had planned non-invasive test, there was no significant difference in terms of results between the patients who underwent a functional test and the patients who underwent assessment by non-invasive FFR and CT angio. But on the right side of the slide, you can see the group of patients who underwent planned invasive coronary angiography, and you can see that in the patients who went straight to the cath lab for invasive angiography, there was a significant number of patients who had non-significant disease, and these are the ones with the red in red, while on the right side you can see that the patients who underwent first this assessment with CT angio and non-invasive FFR, only a small percentage had non-obstructive CAD, meaning that you could do, that's the main conclusion, that probably by using this technology you can do better patient assessment and actually individualize better the patients who may be candidates for invasive coronary angiography. So certainly an important study to open the way for non-invasive assessment of the significance of coronary disease and maybe better planning for the patients who should undergo invasive coronary angiography. Now, the second important study is in the whole field of using imaging, in this case using magnetic resonance, to get a little bit more insight into the pathophysiology of different clinical conditions, in this case in the setting of acute myocardial infarction, trying to understand a little bit better and demonstrate that the myocardial macrophage activity, which is detected by this new enhanced technology of using MRI, and basically here is to improve the diagnosis, maybe to do some better risk stratification of patients with acute myocardial infarction, and the third important goal is maybe to develop some new anti-inflammatory therapeutic interventions if we can look at and identify targets that may be amenable for new therapeutic interventions. And basically what was shown here on the, and you can see here on this part, you could demonstrate by this technique increased macrophage infiltration during the acute phase, and then do the follow-up over the next 3 months in terms of the amount of tissue edema, capillary, leaking capillary, and so on. So basically have a better objective demonstration of all the different changes that occur in the myocardium throughout the time after an acute myocardial infarction. Now, another interesting study that was also shown, and another use of imaging, one of the goals we have in patients who had acute myocardial infarction is to predict the recovery of left ventricular function in these patients. And as you know, there are many techniques that have been used trying to assess this recovery. And here it's used a new technique using PET and using what is called the perfusible tissue index to predict this left ventricular function recovery. We have on the left side the baseline in the two-chamber long axis view, and here you have the bullseye, the polar map. And basically by using a certain cutoff and using this technology was actually called perfusible tissue index. So basically looking at the perfusion in the acute setting by using this technology, this was actually optimal for a more accurate prediction of recovery of left ventricular function, which, as you know, is a big important predictor and also important in terms of risk stratification of patients with acute myocardial infarction. In terms of technological advances, as you know, this has been one area where really there's been a lot of new technology. Let me just show you a couple of examples. In the setting of CT angio, there have been new algorithms that have been developed by different companies. And here we have an example where you can actually have, you have here the pre-contrast CT angio, the contrast, and then this new technology of subtraction CT angio, which basically in relatively fast mode, it can improve the image quality, but also it can get us into new fields where there have been some difficulties, like for instance patients who have stents or who have had procedures. They make it more difficult for the visibility through some imaging methods. And here with this new algorithm, this so-called subtraction CT angio, there was actually better image quality and better assessment of these different conditions, and again improving and expanding the use of this technology to look at coronary artery disease. Now, another interesting area is what is called fusion imaging. As you know, with fusion imaging, the goal is to take advantage of the advantages of each of the different imaging technologies, some with better spatial resolution, some with better temporal resolution, and put them together. Some give a little bit more anatomy, some give a little bit more function, and basically putting them together improve the way we can look at the different clinical conditions. And here is a very interesting development by this Japanese company. This is work coming from Japan, and basically is putting together the images. It's called smart fusion imaging, images obtained with CT and images obtained with echo. And this is the result that I will show you. This is just an example of a patient with an ASD. And you can see nicely the match of the images on the left side with CT angio and on the right with echo. And potentially here, this is still a prototype, again, to take advantage of the different potentialities of the different imaging modalities and do this so-called smart fusion imaging. Finally, one important development has been 3D printing. 3D printing now is all over the place, as you know. And here the goal in this work coming from Italy was trying to look specifically in one part of the heart where we do have some difficulties in getting sometimes important images, is the tricuspid annulus and the tricuspid geometry. And here they went to look at 3D imaging and then did this feasibility of 3D printing of the tricuspid valve obtained from the images of the 3D echo. And basically you have this 3D printing of the annulus, which again opens the perspective of getting better objective assessment and visibility of different anatomic areas, in this case the tricuspid valve and the tricuspid annulus, which could be, for instance, a good way to do some surgical planning and do some better assessment of some disease conditions. Again, this is still research, is still one area where there's a lot to be done yet, but quite exciting to see some of these results. Now let me talk about valvular heart disease and There were a lot of presentations in the setting of valvular heart disease in London, just a few results. This is one important study, a study that looks at the impact of myocardial fibrosis on the survival of patients with aortic stenosis. And this has actually been one area of big debate in terms of, for instance, the recoverability of left ventricular function in patients with severe aortic stenosis who undergo procedure, either a TAVI or a surgical procedure. Some recover better than others, and the question is, what is the reason behind it? And there is a current trend of thought that looks at myocardial fibrosis, and probably the amount of residual myocardial fibrosis in these left ventricles is an important component in terms of also predicting recovery of left ventricular function. And actually here in this study, it's exactly what they showed. They used the MRI. They went to look at all-cause mortality, and when there was significant mid-wall fibrosis or the so-called infarct pattern, these patients, they had a worse outcome, they had worse prognosis than the patients who did not have these patterns. Again, raising the issue of myocardial fibrosis as an important component in the assessment of patients with aortic stenosis, and there are quite a few studies now ongoing trying to look at specifically at this problem. Now, another important area is in the setting of infective endocarditis. We'll be talking about this later on in this afternoon. But here is an interesting study. It's a study coming from Spain, and they went to look at the patients who had acute onset endocarditis, the patients who had non-acute onset endocarditis, and then look at the timing, either surgery or no surgery, and the timing of surgery. And the main message here was that the patients with acute onset who had deferred surgery, they had worse outcome, they had higher mortality than the patients who had early surgery or urgent surgery. And this is actually one of the reasons why now one of the recommendations in patients with acute infective endocarditis, particularly the acute onset, is to do as early as possible, of course if there is indication, but as early as possible do the intervention and do early intervention in these patients, because timing is very important for the results in these patients with acute infective endocarditis. This is another study, in this case in the setting of patients who underwent TAVI, looking at the presence of atrial fibrillation, and these were patients who had pre-existing atrial fibrillation, and the ones who had pre-existing atrial fibrillation, they had predicted higher long-term mortality, so atrial fibrillation as a prognostic factor in patients who undergo TAVI, and this study demonstrates that there is a correlation. And on the other side, the patients who had new onset of atrial fibrillation after TAVI, this could also predict cerebrovascular events at short term after TAVI. So either if the patient has atrial fibrillation beforehand, it's a marker of prognosis, and if develops new onset after TAVI, also it's a marker for an increased, which is not completely, which could be easily predicted. These patients have a higher rate of cerebrovascular events than the others. And again here, the main point here, or the main conclusion here, is the need to do prevention of, in these patients, to review the whole concept of anticoagulation and the protocols of anticoagulation in these patients, particularly the ones who develop new onset atrial fibrillation. Now, these were the study coming from France that went to look at transcatheter mitral valve implantation. As you know, this is now one area. It came a little bit later, but now is booming. And this is in high-risk patients who had degenerated bioprosthesis or ring annuloplasty, and basically, which again is one of the indications now for the use of this procedure. And basically what it showed, this is the overall survival curves, again as a relatively small number of patients, but again we are still in the beginning of this technology. There was significant reduction of gradients, but what is important was that there was a sustained good functional results at follow-up, and also there was a sustained reduction in the severity of mitral regurgitation. You can see in purple was mitral regurgitation 4+, and basically at follow-up, at 1 week follow-up, there was a significant reduction in the severity of mitral regurgitation in the overall population. So again, opening the way for this and showing that this technique may be quite useful in a particular set of patients, of course. This is a niche technology, but that can be quite useful for some patients. This is another important clinical problem, which is the presence of functional mitral regurgitation in patients, so secondary mitral regurgitation, in patients with severe heart failure with reduced ejection fraction. And these authors from Belgium, they went to look at the prognosis and the impact and evolution of this functional mitral regurgitation in patients who had medically managed heart failure with impaired systolic function, with reduced ejection fraction, and they showed that there was severe functional mitral regurgitation in more than 1/3 of this overall patient population of heart failure with reduced ejection fraction. There was a successful improvement with medication in about 50% of the patients, so there is still some room for medication in these patients, but the presence of persistent severe functional mitral regurgitation, despite this optimal heart failure treatment, is associated with poor prognosis. You can see here that there is a significant impact when there is the presence of significant functional mitral regurgitation in terms of prognosis. So it's an important aspect to take into account when do some planning in the treatment of these patients. This is another registry coming from Germany, and the TRAMI registry, and it went to look at the 1-year outcome and predictors of mortality after the mitral clip. As you know, the mitral clip or mitral clip is now one of the procedures that is being expanded. Its use has been expanded for mitral regurgitation in certain settings. We can see here the 30 days and the 1-year follow-up with a survival of 80% at the 1 year. Keep in mind that these are very sick patients, patients who have either no indication for surgery or patients who are at a very advanced stage of their disease. And the predictors of 1-year mortality, they're also summarized here on this table. The presence of things like anemia, previous aortic valve interventions, renal dysfunction, peripheral artery disease, impaired ejection fraction, or severe tricuspid regurgitation. They were all predictors of 1-year mortality, again, in this registry coming out from Germany, looking at the results of the mitral clip after 1 year, which I would say that it's quite reasonable considering the population that is being treated by this procedure. Finally, just a couple of words on some new techniques. This is the transapical off-pump mitral valve repair with neocord implantation. Maybe Henny now you're getting a little bit nervous, but don't worry. But this is actually some interesting development. It's coming from Italy, and they treated 75 patients with severe degenerative mitral regurgitation using this new technique. And again, it showed that if you look at the freedom from mitral regurgitation, there was significant differences comparing the target and the type of procedure that was done, with worse results when the anterior leaflet and the commissural aspects were the ones responsible for the condition, and the approach was in this area they had worse prognosis than the other ones, particularly the ones with isolated P2 lesion, which again had very good results. Finally, the Cardioband, which is the percutaneous annuloplasty for mitral valve repair. This is work from Alec Vahanin from Paris, and the first 40 patients with secondary mitral regurgitation, and basically it showed that 6 months follow-up, again, that there was a significant reduction in the amount of mitral regurgitation in these patients. 85% of the patients had mitral regurgitation 2+ or less after 6 months follow-up, again opening the way for a potential, and here again is a percutaneous approach to the treatment of mitral valve regurgitation. So with this I will finish, again inviting you to our next Congress that will be in Rome. Dr. Hani already mentioned, 27th to the 31st of August. The spotlight will be the heart team, which again it will be very important for the cooperation between the different specialties taking care of cardiac patients, and we'll be delighted to have a big group of colleagues coming from this part of the world. And with this I will finish imaging and valvular heart disease. Thank you, Hani.
Fausto, this is great.